Hello, everyone, and thank you for joining us this evening for the 19th Annual Women's Health Symposium, When Stress is a Signal, in honor of Women's Heart Month. Thank you to the J.B. and Maurice Shapiro Endowment for Women's Health, as well as the American Heart Association for generously supporting tonight's program. Good evening and welcome. My name is Karen Bertozzi. 6 years ago, I was brought to Suburban Hospital for emergent open heart surgery for a genetic condition I didn't even know I had. Fast forward to today, I've spent hundreds of hours volunteering with heart patients and their families through an organization called Mended Hearts, and I'm also the director of the cardiac yoga program at Suburban. I'm so happy to be here tonight and very excited to be a part of tonight's event. Well, as you know, it's been nearly a year since our lives changed with COVID-19, and in that time, our normal daily routine has turned upside down. No longer are we able to go out with a mask and hand sanitizer. We're socially distancing and seeing friends and family over Zoom. No matter what your age, we as women are dealing with physical, emotional, spiritual, and even financial stresses of our daily life. Some of us are isolated, living by ourselves, while others are juggling the demands of careers with the needs of children and older parents. We have all been affected by this new normal. Tonight, we will have an open discussion about how stress affects our bodies, our minds, and our hearts. We will hear from a cardiologist, an exercise physiologist, and 2 heart survivors. All of us will be sharing our unique perspectives on the importance of self-care in the time of COVID. We hope that this evening will be inspirational and informative by providing you with a much needed discussion on taking care of yourself. Before we start, a little bit of housekeeping. We will try to answer all of your questions throughout the program. If you do have a question, please use the question and answer box located at the bottom of your screen. You should see a little tab there, and you will be able to submit your questions there. As a reminder, tonight's webinar is being recorded, and we will make the recording available to you in the near future. And once the webinar is over, you'll be directed to a link for the evaluation. Please take a moment to complete the evaluation as it helps the staff at Suburban in planning for future programming for our community. So again, welcome, get comfortable, and let's learn something together. We'll start by meeting our panel tonight, and I'm just going to ask them to introduce themselves briefly and tell us a little bit about what brought them here tonight. So we'll start with Monique Acosta House. So welcome, Monique.
Hi, Karen. Thank you. It's always good to see a fellow heart survivor.
Yes, it is.
I'm so excited to be here to share my story. My story began when I was just a college student. I experienced a lot of fatigue, arm pain, and just overall not feeling well. And I ignored it for about 3 months, to the point where I was sleeping probably 12 to 15 hours a day. And I finally decided to go to the emergency department to get checked out. I presented there, my heart rate was erratic, my EKG was abnormal, and my blood pressure was as well. And they asked me to come back the next day. I went on a Sunday, and I said, well, I just wanted to get checked out before my week started. And they were like, no, please come back tomorrow. We need to do a test for your heart. So I agreed, and they released me. I came back the next day for the echocardiogram, and they walked me into a small closet, a dark room, and started taking pictures of my heart. And it took a long time. And I said, okay, And then the technician excused himself and came back with someone else. And they kind of talked in hushed tones, looking at my pictures of my heart. And I was like, hey, I got to go to work. You guys said it's going to just be a few minutes. And they said, oh, we're sorry. Give us a few more minutes. They left and came back and brought a third person. And this person had on a white coat. And I said, this doesn't look good. And actually at that point, they told me that I was in congestive heart failure. I had no idea what that meant. But what ensued was a week-long stay, and I was diagnosed with dilated cardiomyopathy. And I was in heart failure. I had an ejection fraction of 15%.
Wow.
So that started my journey, and I enrolled into a clinical trial. It saved my life. This life-saving medicine changed my whole heart. It remodeled it. And I lived pretty normal for a number of years. I was able to have a son against all odds. And then I had a tragedy. My mom passed away. And all the tools that I learned about eating right and having a great diet and exercise, I just stopped. And it was really remarkable. I have a really good relationship with my cardiologist, and he showed me the actual data that showed from the time that I stopped exercising, 9 months later, my heart started to deteriorate. It was my lifeline. I was very active, and that led to heart failure again. But the good news is I was able to get a heart transplant. And so today I am a heart transplant survivor and thriver, and I'm just happy to be here to share my life experience.
Wow. Thank you for that. And we look forward to hearing more about what you have to say about all the topics tonight. And then, of course, we have Marie Gallagher. I'm going to tell everybody a little bit about yourself.
Hi, Karen. Yes, I'm Marie Gallagher. I am the cardiac rehab manager at Suburban Hospital. I've been doing cardiac rehab for 20 years this year, and I've been managing at Suburban Hospital for the past 13 years. So as growing up as a child, I always was in athletics. So I was playing soccer, I was playing basketball, I was doing gymnastics, you name it, swimming. I did it. And then in my college years, I switched over in later high school to track and field and ran. So when I was running a road race called Red Beans and Rice down in New Orleans, and I had a cardiac rehab manager approach me and say, hey, do you want a summer job? That started my journey in cardiac rehab. So from there, I went back to Virginia Tech, quick track, because I couldn't do both, and started my journey to cardiac rehab. So that's kind of where it all started. It was a perfect meld of my athleticism and giving back and caring, because that's what my family does. We're all in some sort of civil service. So that's my story.
Thank you. And then welcome Dr. Carolyn Wu. Do you want to tell us a little bit about yourself as well?
Sure. My name is Carolyn Wu. I'm a cardiologist at Johns Hopkins Community Physicians Heart Care Practice at Suburban and Chevy Chase. I just joined last year. So I grew up in a family where nutrition is a really big deal for us. My mom basically said we need to eat healthily, and we should always cook our own food. So prior to going to medical school, I decided to get a nutrition master's degree. And I think it was a really great decision because most of the doctors we have minimal nutrition education during medical school, near maybe one class talking about nutrition. But as we know, there's a lot of sort of dietary effect to diseases, prevention, or secondary prevention. So while I was in training for cardiology fellowship, I was deciding which area that may fit my interest the most. And I decided that I think preventive cardiology is where my heart lies, because if you can prevent a disease from happening, that's sort of the best thing you can help your patient. So here I am. I'm happy to be here to be one of the panelists. Thank you for the invitation.
Awesome. Thank you for that. So we'll just start rolling through some topics. And again, those of you that are attending tonight, feel free to start putting your questions into that space at the bottom of your screen. I think Monique, we'll go back to you. I wanted a little clarification. So the time from when you were first diagnosed in your 20s to transplant, how many years was that?
Over 20 years. I was able to keep my native heart for 20 years. And I attribute that to diet and exercise.
I was going to say, talk a little bit more, if you can, a little more specifically about what you did to keep your native heart, really healthy for that long.
Well, at 22 and 23, I ate whatever. I just finishing college, I didn't eat well, I didn't sleep well. But I knew I had to change in order to live. The medicine could only do part of it. And so it just so happened I wanted to lose some weight, and I found this clean eating program, and it taught me how to eat portion control and to have protein and carb and fat all, together. And it didn't talk about macros and, points, or it was just food. And so I learned at an early age just to eat well and to reduce my sodium. And even now, when I share that, I don't eat beef or pork, and that's because of I have IBS and it just disturbs my stomach. But I eat, fish, a lot of fish. But it's easy for me to eat that way because I've been eating it for 20 years. So post-transplant, actually, they told me I can have more sodium now. I don't have a fluid restriction, but I still, food is salty to me. Eating out, it tastes very salty because I don't cook with salt.
Yeah. Yeah. And so, well, I think you just answered the question. We were going to move on to, what advice would you give to patients? I mean, go back and look back into your journey. What advice would you, I guess, maybe give to your younger self in terms of maybe things you could have done differently, or any type of emotional advice you could give to a patient who's currently dealing with a diagnosis of some kind, right? Somebody who's kind of stuck in the thick of it. Like, just kind of tap into that if you could, especially, maybe some emotional advice.
Yeah, one of my quotes that I just came up with is love your body like it's your best friend. We give each other so much grace and love, and we don't give that same attention or, just patience with ourselves. And I have so many people say, oh, I try to eat right. And, I remember the first time I decided to give up meat, I was like, I'm just going to go cold turkey. By day 3, I was eating a hamburger. So I think just setting small goals. I have a friend who was just diagnosed with high blood pressure, and she's a very good friend. And you know what I told her? I said, exercise 15 minutes when you get up, and exercise 15 minutes after you eat, toward the end of the day. And she's doing that.
Yeah.
Set small goals for yourself and be kind to yourself and be reasonable. It's like with my son, he started to learn how to walk. He learned to walk at a very old age. He was 16 months. But I was cheering him on. I never wanted to say, oh, you fell down. I was like, no, we need to root for ourselves. We need to cheer each other on, and we need to have family and friends and laughter. It's good for you. And so I really encourage people to take one day at a time, and if you can't do one day at a time, do 1 hour at a time. You can't do that, do 1 minute. We all can just do 1 minute. Life gets overwhelming, especially with the pandemic. So just be gentle with yourself, but set those goals. Set the goals. Drink the water. I have mine here. Right. But and have accountability. That works too.
Yeah. I can relate to that so much. I know I got to a point in my heart journey where sort of my motivation was more about what's happening on the inside instead of how I looked on the outside, right? It's really more important about, especially if you're looking at heart disease, what's actually happening on the inside in your numbers, that sort of thing. Dr. Wu, can you talk a little bit about the difference between a man's heart, a woman's heart, and sort of if and how they process stress differently, like the dynamics of all of that?
Sure. So women's heart tend to be a lot smaller than men's, because we have different body size, and as a result, women do have smaller arteries, and they're more prone to blood clots as the diameter of the arteries are smaller, and it's also more difficult to repair. For example, like stenting tend to be slightly more difficult. Women also have slightly higher heart rate. And sort of as women age, we do see that women have more HFpEF is what we call, preserved ejection fraction heart failure, and that's basically kind of stiffening of the heart, but with normal pumping function, but it's more like a relaxation issue, and that's sort of different from men in terms of their heart function at the end of the life. In terms of how stress affected differently, there has been a recent research from Duke University that says, men have more changes with just blood pressure and heart rate response, whereas women tend to experience more what we call heart ischemia, decreased blood flow to the heart. So women has more profound effect in terms of how the arteries respond to stress. And women also have something that's more tend to happen to women is what we call a stress-induced cardiomyopathy. It can be induced by any physical stress or mentally stress, and multiple study has shown that if for some reason just happen to women more. Also in terms of having chest pain symptoms, there is another condition called Prince-Metal angina, and it's not necessarily because there is a blockage from blood clot in the arteries, but it's more because there's some spasm happening in the artery causing the chest pain symptom, and that seems to also affect women more. So they're just sort of different physiology that affect men and women's heart differently.
And I would imagine estrogen plays a role in that. I mean, and how those of us that are sort of, as you move through the stages of being a woman, educate us a little bit in terms of how estrogen and lack of, right, as your estrogen levels start to decrease, what is happening to us cardiovascularly?
Yeah, so we tend to think about young women being protected from heart disease with estrogen, and it's true that when the average age for men having heart attack is around age 55, and women tend to have it later around 65. So I think something that women don't really realize is that, we think about, we have estrogen, it's protective, but as we start getting to the age of 65 and later, the rate of heart disease is basically the same as men, and even a higher rate than men. So it's definitely something to think about and pay attention to that. So that's as far as we know how estrogen is protective during those younger period. Yeah.
And what does a heart attack look like for a woman? Typically, Dr. Wu, what does it look like for us?
So women are known to have what we call atypical chest pain. So when you think about the heart attack symptom for men, is usually what we think about: an elephant sitting on the chest, pressure radiating to the jaw and radiating down the left arm. Women sometimes can have really non-specific symptoms like fatigue, shortness of breath, or stomach pain, back pain. They just don't feel like themselves, right? And I think women, since a lot of women are caretaker of the house, so we feel like we need to really take care of the house. We don't really take care of ourselves as much. So a lot of time the symptoms are ignored and even downplayed. So I think for patients' perspective and then also from physicians' perspective, there are definitely missed opportunities where people aren't thinking about women having atypical chest pain as a manifestation of their heart attack symptoms.
And some of the things that you're talking about, we're starting to get some questions rolling in. So Dr. Wu, continuing on with you, maybe touch on stroke just a little bit as well. Sort of, does it look different when a woman presents with stroke, and maybe just touch on that for a moment.
So, stroke, it's in terms of heart attack and stroke, both are what we call vascular disease, and stroke basically is the equivalent of heart attack, but basically brain attack, having decreased blood flow to the brain. And as far as I can tell, the symptoms of stroke for men and women tend to be pretty similar because the symptoms are more neurological. So like a facial droop, one side weakness, that tend to be more similar in terms of the presentation, whereas heart attack, the response or the effect of how the presentation tend to be different for different genders. And then if someone has a risk factor for heart attack, or if someone has, prior risk of heart attack, obviously they do have higher stroke risk, just because if they have abnormal vasculature somewhere in the body, say in the heart, then they do have higher risk of abnormal vasculature in the brain as well.
Mhm. And then can you discuss a little bit, still with Dr. Wu, the link between stress and heart disease? I guess I'm always so curious about physically the anatomy, what's happening, right, as the adrenaline is released and cortisol.
Mhm.
Speak to that a little bit and kind of educate us a little bit in terms of stress and heart disease.
Sure. So there has been multiple studies showing depression, anxiety causing physical heart disease. So we know when people are under stress, there's higher adrenaline, and there's sort of an inflammatory response or inflammation that can be more pronounced when someone is in stress. And I would say there is sort of the direct link of stress to the heart, and also there's some indirect effect of the stress to the heart. So some of the direct link, including stress cause inflammation, cause more artery plaque formation, so that can definitely escalate blockage in the heart artery. Stress is known to cause more high blood pressure as well, and that's certainly a risk factor for coronary artery disease. Stress has also shown to lower the good cholesterol, the HDL. And there are also the indirect effect of stress to the heart. For example, someone may decide that they need to smoke due to their stress. They are probably less likely to be physically active, so physical inactivity due to stress, or overeating, poor sleep. Those are all contributor to heart disease.
And Dr. Wu, we have this question coming in from the group, back to estrogen and the protection that it gives to the heart. And so what are your thoughts on recommending taking estrogen during perimenopause or in menopause to reduce heart issues? What's your thought on that?
So, that's sort of a controversial topic. I think overall, the recommendation is that long-term, it is not recommended based on, there's a large nurses study in the past that as women get older, estrogen can actually, there's higher mortality and higher cardiovascular complication from that. But in terms of helping symptoms during perimenopausal period, I think that's considered okay for a short period of time, but certainly, for women well into 70s, 80s, that's generally not quite recommended. So
yeah. Okay. So this question goes back to Monique. Couple questions. What helped you cope as you got your first diagnosis when you were young, right? So I guess when you first got your cardiomyopathy diagnosis, like emotionally, how did you cope with that?
Yeah, I don't really think that I understood the severity of what they were telling me. I was just focusing on getting better. I was young, and whatever they told me to do, I just did it. I just wanted to get better. And I think looking back, it was probably the way my coping mechanism worked. I didn't think about, I didn't like feeling tired. I didn't like feeling sick. And so they said, don't, when you're on a blood thinner, you have to have your diet regulated. Don't have any extra spinach. No extra spinach. They said walk for 45 minutes. So I followed the rules. I wanted to live. And I wanted to, get on with my life and move and get married and all the things that I end up doing. So I think just being a cooperative and a compliant patient. And then after the fact, once I started to feel better and get better, then I started to have more of an emotional, like, okay, this is a big thing that's happened to me. But in the process, honestly, Karen, I just wanted to just follow the rules.
I can so much relate to that. so much relate to that, whatever. I'm very compliant as well. So I get that. I really,
Not always, then when I became more comfortable, I began to be, ask more questions and push the envelope. But initially, yeah, I just wanted to get better.
right. I totally understand that. And then Monique, so what changed after transplant? Did you maintain your commitment to wellness and fitness? Like what changed? Even emotionally, what changed for you after
One of
transplant?
the biggest things is, now that I'm thinking about it, I stopped comparing myself. That's one thing as a heart patient. You want to compare yourself to who you used to. I used to be able to do the bar with two. No, can't do that. I mean, I can work on getting there, but appreciating where you are and not comparing yourself. One of the things that really surprised me was that my level of energy didn't return back. I thought I was fatigued prior to transplant, and then after transplant, I thought I was going to have this surge of energy. I had a new heart, and that didn't happen right away. And so, just understanding that my body was still adjusting, and so I've become more. I started off saying being patient with yourself. I had to serve that up and eat that every day, even the way that my neurons and how I process, it was a little bit slower. And I'm just used to being very, very fast and being very capable. And so, when I first returned to work, I had a whole desk full of sticky notes. Reminders, yeah. Because
but your brain is filled with so much more information, like medical stuff, right? That's what I tell myself all the time.
yeah.
Well, thank you for that. So Jean Marie, what would you say to women who say they don't have time to exercise? And can you give them and us some tips in terms of starting a program that would be, beneficial to our hearts?
Monique touched on it earlier, but it's keeping it simple. I think what people do is they read the guidelines and you have to exercise 60 minutes, 5 days, and the 150 minutes per week, and they just get overwhelmed. So recognize where you're at and start from there. So, people will start with people saying, if everybody's wearing some sort of device these days, what's your normal steps per week, and increase it by 5 to 10%. Just start with just small little goals and doing little, exactly as you said, just little bursts of activity throughout your day. If you do 10 in the morning, 10 at lunch, and 10 at dinner, 30 minutes, there you go. So start small. Exercise doesn't have to be elaborate. You don't have to have a Peloton. All you have to have is a pair of shoes and go outside and walk. And so I think that's where people really get overwhelmed with it. And so you just have to recognize where you're at, start where you're at. And, it might be, talking about heart failure patients, they might start with 1 to 2 minutes of activity and then rest, 1 to 2 minutes of activity and rest. That's where they're at. So it's just recognizing your body, what its limitations are, and start with where you're at, and just nice, slow, easy progression, and you'll get there. But don't overwhelm yourself looking at what the recommendations are, and people just get, discouraged by it and don't even begin.
That's great advice. Really, really great advice. We have a question coming in from the group, and I guess this would be for either Jean Marie or Dr. Wu. It says, I'm a 63-year-old woman in fairly good shape. My resting heart rate dips below 40 about 8 to 10 times a day. Is this considered an issue that should be checked by a doctor, and what would be causing this?
Sure, so I can answer that. So it really depends on what kind of rhythm we're seeing when the heart rate does drop to 40s. If say there's heart block, when that happens, then you should definitely seek healthcare for that. So I think the first step is understand what kind of rhythm it is, and understand from the doctor's perspective, are you having any symptoms? Something to think about, heart block can cause that. Thyroid function, if it's abnormal, that can also cause it. So it's usually the first thing we check to make sure there's no thyroid affecting the heart rate to go that low. But I would say even for someone who's athletic, heart rate in the 30s, unless they're sleeping, is it quite slow. So I would say probably get evaluated.
And Dr. Wu, would you recommend that they check in with their primary first, or would they go straight to a cardiologist?
I think it sort of depends on their referral system, but it's something I'm sure the primary care is going to send to a cardiologist for further evaluation of getting EKG, getting a heart monitor to begin with. Obviously, primary care can always check the thyroid first.
Right. Okay, great. Let's see. Dr. Wu, tell us about, are you seeing younger and younger women coming into your office? And Jean Marie, this is for you too, really. Like, are you finding sort of the woman heart patient, it might be starting to be a little bit younger?
Yeah, I would say, I see a good range of women, younger, older, and some women come in with palpitation symptoms that seem to be, they come in all ages. I have college students coming in with palpitation symptoms. And then truthfully, sometimes it could just be anxiety. We know anxiety can make people feel palpitations. And then there's also some atypical chest pain. Some family have history. There's some family with family history of premature coronary artery disease, and I do have young women coming in with chest pain symptoms that are concerned because the family history. So I would say, yeah, I mean, it can happen with younger women, and so don't ignore any symptom you may have. This may be kind of going to the questions later, but during COVID, I have seen some younger women patient, college, young professional after COVID, they recover fine, but then they start having palpitation, they start having sort of chest pain symptom that may be related to, say, pericarditis, which is kind of inflammation around the heart sac, and a viral syndrome is known to cause that. So I do see some women patient coming with that symptom. Also have seen people coming in with what we call POTS, which is Pustular Orthostatic Tachycardic syndrome. And there seems to be some correlation where some patient recover from COVID now is having POTS where whenever they stand up or do any activity, their heart rate goes above 100, and that's symptomatic for them. So it's more like a trend we're seeing. It's sort of difficult to say whether it's a direct result as from COVID or it's a direct correlation, but definitely there's some trend that we are seeing.
And I assume that trend will become much more clear with time, right? As we move out of the pandemic and there's more data to kind of really pinpoint what's happening to these patients.
Yeah, exactly. As we know, the COVID literature kind of changes every single day. So
right. Interesting times we're living in, right? So a question here, any thoughts about meditation to reduce stress? I mean, I have a very a background in this, and I'm welcome, you all are welcome to chime in. I've been a yoga teacher for about 15 years. And as I mentioned earlier, I helped to do the program for the hospital. And yes, meditation can reduce stress. And in a nutshell, just focusing on your breath starts to tweak your nervous system a little bit, and then that affects sort of the release of some of the cortisol and adrenaline, the stress hormones that can cause inflammation in the body. So yeah, meditation, don't think that it's too easy, and don't think it's not for you. Give it a shot. Try it 3 times a week for maybe a month and just see the changes that you might benefit from it. And there's so many great apps out right now, and so many different ways to access really good meditation guidance. Let's see, what else do we have here? Let's talk about diet. So back to you, Dr. Wu, if you don't mind. Can we talk a little bit more about heart healthy diet and the best way to start eating healthier?
Yeah, so multiple dietary guidelines have recommended more a dietary pattern approach, kind of similar to what Monique was saying. Think about macronutrients, kind of like thinking about whole foods and not too much thinking about the little ingredients. So something that I think is very helpful, there is dietary guidelines for Americans 2020 to 2025 that just came out not too long ago. And they actually have a website. It's www.myplate.gov. And it has a really nice diagram to kind of help you start simple. Think about your plate in a 4-quadrant perspective. So if you cut your plate in half, you want half of that plate to be green leafy vegetables and fruit, and the other half of it should be sort of grain, and then the other half think about as protein. And when you think about vegetables, should be green leafy vegetable that you can see all the ingredients. So generally, we want to think about cooking, eating food that haven't been processed too many times. If you see some food and you can't really know what it is, then that's not something that you should be eating. And in terms of the grains, we typically recommend whole grains. So like brown rice is great. If someone is eating pasta, then think about eating like wheat pasta instead of white pasta. So, and then your protein source can be something like tofu, chicken, white meat. So think about like a pattern, a dietary pattern. So you can start with the grains you want to cook for the day. It could be rice, like wheat bread for breakfast, something like that. And then think about the protein. It could be fish, some item, and try to sort of start with, like a whole piece of chicken or whole piece of fish, and vegetable, find an easy way to prepare vegetables. So I usually, just steam, stir fry my green leafy veggies with water and olive oil, something simple, and kind of start from there. Something sort of similar to what Monique and Jean Marie was saying, start slow, give yourself just, a little small goals to begin with. If you think about like, oh my God, I have to change my diet overnight, and it's sort of too much, too overwhelming. So we usually think about making little changes, because we know behavioral changes is really difficult. For example, quitting smoking, we usually generally tell people, okay, don't quit cold turkey. Maybe some people can do that, but for a lot of people, it's so difficult. So then you sort of give them a little goal. Okay, this week, why don't you just cut down 2 cigarettes? So similarly for diet, if you want to say, okay, I need to work on my diet, completely change the dietary habit, you can start, the first week switching from, say, white rice to brown rice, and that would be your change for the week. And next week, if you have another goal saying, okay, instead of eating potato as the vegetable, I'm gonna change to green leafy veggies. So do that for another week. So basically start slow. If someone likes sugar beverages, say they're drinking 2 a day, that's extra sugar, extra calorie, then some little step can be, okay, just cut down on 1 and do it for a week, and then drink and replace that with a water, and then do it slow. Basically kind of like what we call like motivation strategy. So you sort of think about little things at one time.
Okay, very, very good advice. Kind of shifting gears a little bit here. Let's talk about, does emotional crying release stress? Does anybody want to take that one on? I mean, I think it does. I don't know the science behind it, but I think everyone on the panel would agree with me. I think it depends.
Yes, you don't want to pent it up.
No.
I think having a release and having a way, finding your way to let it go. And if sometimes that's a good cry, then cry it out. You just have to find what your needs are at that time, depending on what's going on but you having a support system is crucial. But, also not, letting yourself have emotion. It's okay. It's okay to, I think we try to be strong and take care of each other and our families and our loved ones, but it's okay to ask for help ourselves.
Really good point, especially us as women, right? We're always taking care of everybody else. I think I know I can't be reminded of that enough, right? I think, and that's really what we're after in terms of getting together tonight, learning how to manage stress and taking care of ourselves so that we can really take care of everyone else. Here's one, Jean Marie. I think this one's for you. How can I help motivate a loved one to start exercising without nagging? That's a hard.
I'm guessing this is a spouse.
Right?
Yes, it's difficult, you know, and you can't force somebody to do something. So, you know, that's, I know Dr. Wu can talk about this when you're talking to somebody about smoking. If they're not willing to make the change, you know, they're in that like what we call pre-contemplation stage, you know, they're not there yet. So you just have to slowly encourage, motivate, invite, you know, them to do exercise with you. But, you know, recognize that the person has to decide that for themselves too, as well. You know, if they're not willing to make that choice, it's going to be nagging, you know, to them. So the more you can motivate them, and gearing somebody to exercise, it's not thinking about the end result. What do you want out of life? Exercise is the tool to get you there. If you want to be able to travel, if you want to be able to see your grandkids get married, if you want, you know, these sorts of things, if you want that, you have to exercise. So that's the, you know, that's your method to get there. Don't think about the exercise itself, because I think that they'll call it torture, but you want to think about the end goal. Like how do you want to live your life and your quality of life? Exercise is your tool to get to that point.
I love that. You said that so.
Hey,
well.
Karen, so I like to add to that. I have a new COVID hobby. I learned how to hula hoop.
Ooh, that's good for the core.
It is very good for the core. It's a weighted hula hoop. It weighs 5 pounds. And, you know, I just needed something else. My instructor says, find something that you love and move.
Yeah.
You know? And I love my walks. I live here by a park and it's water, but it's cold. And I don't love my treadmill, but I do love my hula hoop. And I can just stop in the middle of the day and, you know, hula hoop for 10 minutes. I put on a song, I play it twice, and it's 10 minutes of exercise.
I love that.
I love my Tabata class. I
Yeah.
love that, you know. So, but pre-COVID, I didn't do either one of those.
Yeah.
So just finding something that you love and move.
Yeah. Well, and for me, especially during the pandemic time, mine is walking our puppy. So that's been my new, you know, you guys that know me know that I'm crazy about Gus. Okay, so let's talk about a couple of these questions are related. And Dr. Wu, maybe, well, I have a little insight as well. There's some questions about family history, and that's kind of been my platform since I had my emergent open heart surgery 6 years ago for an ascending aortic aneurysm with dissection that came from a family history. It was revealed as we sort of looked at my case. And I am a huge proponent of knowing your family history. Do not put your head in the sand. Know what's going on. Try to connect the dots and discuss it with your providers. I mean, discuss it with your OBGYN, discuss it with your primary care, discuss it with your dermatologist. Everyone should know, in my opinion, your family history, because there are things that kind of come up all throughout your history as a patient that can be connected, right? The dots can be connected. And I can't talk enough about the importance of really knowing your family history. So this question talks about, this person, I believe, has high blood pressure. There's a family history of it. How do they know when they should shift away from their primary care physician to a cardiologist? Dr. Wu, do you want to speak to that? We touched on that earlier, but you want to?
Yeah, so something depends on the age of the diagnosis. Say, is it normal for someone to have high blood pressure around age 50, 60? That's probably fairly normal. And it would be abnormal for someone in their 20s or, you know, teen age to have high blood pressure. So that would be something that's not quite normal, and that would require like a specialist further look into it to see whether there are other secondary causes or not. Generally, blood pressure can be managed by primary care, and then they're good at it too. Sometimes when they get into, say, 3-4 agents and they're still not able to get the blood pressure controlled, and that would be the time to seek a specialist, either a cardiologist or a nephrologist. And those are sort of things to kind of think about when the primary is not able to sort of figure out why the blood pressure is difficult to control.
And here's another question. I think, now the questions are really rolling in. All right, my PCP did an EKG and all looks good. I'm 52 and exercise moderately, but could lose some weight. Should I be going for other testing? My blood pressure is normal and other blood work is normal.
So I would say if there is no family history of any early onset heart attack or any sort of, family history of heart failure, and if you don't have any symptoms, I don't think you need to have any additional testing, especially if the cholesterol has been well controlled. There's really probably not much to be concerned about. But obviously if someone is doing well, but then there's a family history of, say, sudden cardiac arrest or even just heart attack at a younger age, then I would probably at least, think about some other preventative measures to do some screening. And these days, I do what we call coronary artery calcium score, CAC score. And it's a powerful tool to look at your heart arteries health in an asymptomatic person with, say, really high cholesterol or prior family history of early onset heart attack. So at least we kind of understand someone being asymptomatic and their heart health at one period of time.
Okay, I'd like to move the discussion, talking a little bit more about sort of the times we're living in with the pandemic and COVID-19 and how it's affecting all of our stress, right? Everybody's lives have changed, and just kind of bring the discussion a little bit closer in terms of heart health and what you're seeing in terms of COVID-19 affecting. So I guess, Jean Marie, is it safe to come to the hospital? If I'm not feeling well, is it safe for me to come to the hospital? Let's start with that.
We are the safest place in Montgomery County to come to the hospital. And that, I think, has been the unfortunate side. And I hear that time and time again, not only cardiac, but the patients that we have in the hospital are so much sicker because they're so much further in their disease processes because they didn't get the preventative care. When, because they were afraid they were going to go to the hospital and get COVID. Well, guess what? You got more sick because you didn't do the preventative care that you needed to do. So it really is the safest place. We clean the heck out of everything, and it's so much more that it's so much more protected. So definitely do not delay. Make sure you make those appointments. They may be telehealth appointments, but make sure you're having those appointments. Don't delay your care. With the cardiac, we do see probably the most common thing that people don't recognize is if they are an exerciser and active, they'll excuse this away, but from 1 week to the next week, there's a significant change in their fitness level and what they're able to tolerate. Here they are running 1 week and now they can't even run, and they don't really understand why. There's no chest pain or severe shortness of breath, but they had to switch to doing a bicycle or an elliptical trainer, which is just a little bit slighter. This story has happened time and time again. I see in cardiac rehab, especially with the younger population, and they will just say, oh, I'm distressed or tired, and one of the patients I was talking to about it today had 5-vessel bypass, was underneath all that. So listen to your body. If you notice a change and it happens pretty abruptly like that and you're not able, that's something to talk to your doctor about. So just make sure you're paying attention to your body and get the preventative care. Don't delay your appointments because that is the reason why our hospitals are full right now, not because of COVID-19, but because of the side effects of COVID-19 pandemic.
And Monique, have you taken anything new happening with you in terms of you're taking care of yourself during COVID? Do you have to be super vigilant about, exposure with the transplant? Have your meds changed? Like, what are you doing differently?
Well, post-transplant, I wore a mask every day for 9 months.
And you probably quarantined a little bit too, right?
I'm sorry?
And you probably quarantined a little bit too.
Oh, yes. Yeah, I was in a bubble for several months. So it's not that hard for me, even up until I think a year ago. I work in DC and I commute on the metro. I wore a mask. I wore a mask. People look at me and I'm like, the mask is to protect me, it has nothing to do with you. I wore a mask because my immune system is compromised. And so for me, I'm always been, anal while cleaning and, having things sanitized. But the only main issue that I think that I'm having is I miss people. Like, I call it the year of no hugs.
Yes. Yeah.
So I'm hyper vigilant.
Mhm.
Also, I was just reading that, women are caregivers, and the pandemic has really, really caused women to leave the workforce. And I think about that, they by comparison, I have the number written down. Um, they've lost 4 times their employment than men. And that stress, the stress of carrying up, I'm in the sandwich generation. You care up for your parents, you care down for your children. And so I wanted to comment, meditation it works for me. It does. I start my day with meditation. And I didn't start that habit until March of last year.
Mhm.
And it really sets my day with the guided breathing. It sets my intention. And I can tell the days that, I don't put that time in, have that me time in the morning. Another symptom that I have with my medication side effect, when I'm really tired, I have tremors, or if I'm dehydrated, it's the medication that I take. And so working at home, that's why I have the water. I forget to drink my water, or, I'll work for 10 hours and, then I have personal meetings that I Zoom into. And I'll get tired, even just being at home. And all of a sudden I'm like, why is my hand shaking? Because I'm not taking care of myself. So listening to your body, even, when you're at home, when you think that you're in your little eco sphere and, all is well, you still have to be diligent about it.
Yeah. Yeah. I agree. Dr. Wu, do you have any insight in terms of what you're seeing with COVID-19 and maybe different strategies for women as we're dealing with the pandemic and our ability to take care of ourselves? Any insight or thoughts on that?
I certainly, from the link between stress and heart disease, I think understand, like, acknowledge your symptom, your stress, and kind of understand the situation and sort of think about what help you need, either from the provider or from a friend, from any family member. I think acknowledge that you need help, you need to sort of really take care of yourself is a big step, because I think women, we sometimes don't take care of ourselves and then don't acknowledge that we need it. So I would say something to just be aware of what your needs are. And I say that to, sometimes I say it to my colleagues as well, like, we are providers taking care of patients, but we also need to take care of ourselves as well. If we can't take care of ourselves, then we really can't take care of patients. So similarly, for women as caretakers, we really need to take care of ourselves before we can really take care of others.
Yeah, I mean, we hear it time and time and time again, right? That's the challenge. We need to hear it over and over and over again. So let's move on to, I have a couple more topics to cover. Clinical relationships. So, Monique, I'm pretty sure you and I feel about the same with this, but speak a little bit about how important it is to have a trusted relationship with your provider, with your team, with your surgeon, with your whole team.
Our whole team. It's made the difference. It's literally made the difference. The type of dialogue and the type of trust, even I talked to my nurse practitioner earlier this week, and she says, well, I have to consult with your boyfriend, because he's dear to me. And she's teasing, but we do, and when I went to my clinic visit, and she says, he's safe to hug, you can hug him. And he hugged me, because I called it the year without hugs. And just knowing that, he deeply cares about me and he respects my opinion. And so, I've been having this situation, this problem. And I said, these are my symptoms. I've been tracking them. I've done the data. And I think a lot of times with healthcare, it's data driven instead of patient. And so he walks that line with me. He says, you know what? I hear you. I listen to you and I trust you. And I recall he told me a long time ago, he says, if you have a physician that doesn't speak in a way that you understand, that you leave out that day out of that office and you don't know what happened, that's not the doctor for you. He told me that. And he was the doctor for me. I remember talking about my mitral valve, and he had this little balloon thing. He says, oh, he drew the balloons and he showed how they closed the door. And I knew I was able to go home and draw a picture and say, this is what I have and this is what it's doing to my heart. I was able to translate that. So the patient-doctor relationship is very important for a heart patient, for any patient, but especially for a heart patient.
Yeah, I agree completely. And Dr. Wu, maybe you can speak to, what is the best way a patient can prepare for an office visit with you? For instance, say I'm coming to you as a first-time patient to a cardiologist, right? I'm going to be very nervous. I'm going to have white coat syndrome. I'm going to be confused. I'm not going to have all my questions written down. Like, what is your recommendation if I'm seeking you out for the first time? How can I best be prepared to walk away with the understanding that Monique just described and just feel good about a relationship that's starting? Because really, a cardiologist may be in your life for years and years and years and years. So how could we prepare as patients?
I think just, come in like yourself, be relaxed, and then, have a dialogue. It's kind of what we're having right now, right? Have a dialogue, ask a lot of questions. If you don't understand something, just keep asking. And something that's maybe not as much appreciated is that when you go to a doctor, you kind of want to feel comfortable to be able to talk, and then sort of make sure that the doctor is actually listening to you. I think there's a study saying the average time a physician wait before interrupting a patient is like less than 10 seconds of talking. So it's really sort of something that, just come in like yourself, ask questions, and then, address your concerns if you feel like your questions are not answered, you don't understand something. And if you feel like you need additional time, then that's okay. You can always come back later. But I think having feeling comfortable with a visit is very important, to just have a report to begin with, and then make sure that your physician is actually listening to you, really addressing your concern. And just don't be afraid to ask questions, because I think the more you know about any condition, and the better the physician is able to educate you, the better you can develop the relationship and develop trust.
Right. Yeah. Dr. Wu, this would be for you. A question just came in. I have a 22-year-old who is on carvedilol and Entresto 2 times a day. She has cardiomyopathy from her cancer treatment years ago. I suspect she is not diligent in taking her meds, and there's nothing I can do about it. How serious is it to miss doses here and there for this patient?
Yeah, so those 2 medications are really great medication that are what we call cardioprotective medication that helps the heart to heal. So as much as you can, I think it's something that similar to what Jean Marie was talking about. If people are still in their pre-contemplation stage, they don't understand the seriousness, it's kind of hard to tell them to do something. So I think the more you can educate them about a condition, the importance, and then what they want in life, say, okay, she's 22 right now. Does she want to live until 30, 40, 50? If that's important for her, and obviously, for this participant, then it's something to kind of focus the issue from a different perspective, instead of telling her like, okay, you need to take your meds, but really focusing on what the big picture is, to sort of change the motivation differently.
Right. Yeah, create that new habit again. Any risk in taking calcium resulting in calcium deposits in the arteries. I think you spoke about the calcium testing.
Yeah, so, the last time I looked into this topic, I think it's fairly controversial. I don't think there's a uniform research saying one way or the other, or I think there may be conflicting information. Generally, I say take vitamin D. It's pretty much what you need. And then if any calcium you need it, take it from a whole food source like dairy, something that your body will absorb whatever is needed instead of taking the extra supplement. So I would say generally I tell patients like supplements aren't really as effective in terms of really getting the nutrients you need as eating whole food, just because nutrients are absorbed sort of synergistically. If you sort of just take some supplement, it really doesn't get absorbed that well. So if someone's concerned that, okay, so for osteoporosis, they do need more calcium deposition, then vitamin D plus a dairy would be a good option, just because I think calcium is more controversial.
And just to tap into that, how much vitamin D do you recommend? What should we be taking?
It really depends on your vitamin D level. Based on different deficiency level, there are different recommendations. So it's sort of dose-based based on the deficiency.
Yeah, so on your lab work, right? You get blood work.
Yeah.
Gotcha. Okay, so let's wrap this up. I just wanted to kind of go around with all the panelists, and we have touched on this a little bit, but what is one thing that you have done to stay healthy and practice self-care in this past year during the pandemic? Who wants to go first?
I'll go ahead and start. So as many of you know, I've been in my MBA program working full time in a hospital during a pandemic. So a little bit of stress this past year. So I think it's really the balance approach, making sure I got enough sleep, making sure I'm eating well, making sure I'm exercising, but not being hard on myself if I didn't get the normal exercise that I would normally do before all of that. So, but just making sure you're getting that balance approach and that you're focusing on your own health so you can make it through all of that. But the sleep, exercise, eat well. There you go.
The balance of everything, right?
And the balance of everything. It has to be it all.
Yeah. Dr. Wu, anything to add? What are you doing to stay healthy and self-care in this time?
Yeah, so I pretty much used to cook a lot, and then during pandemic, before I feel comfortable going to a restaurant again, I essentially, cook all my meals, bring my lunch to work, and I even make my own yogurt. So really, cooking from scratch is what I've been doing. And I started doing online yoga even before the pandemic, because it's kind of hard with medical school schedule, residency schedule. So it's something I'm still doing right now, just doing online yoga on my own time. So kind of like what everybody's saying, eat well, cook your own food, and exercise. So,
Monique?
Yeah, I co-sign with the meal prep. I have to, back on football season, it's easy on Sundays, just cook a couple of meals, and that way I can have variety. But the one thing that I have incorporated, which is really, really hard for my personality, sometimes I have a do nothing day. Like, I just sit around. I don't fold laundry. I'm not wiping down the baseboards. I'm doing nothing, for like a good chunk of the day. And that is just so uncharacteristic for me, because there's always something to do, right? I only know one language. But yeah, just being able to say, I'm just going to sit here and read this book that I've been trying to read for the last 3 months, or I'm going to call my aunt who is, 90 and catch up with her, and just value my life and live it in the moment, and honor my relationships. And you can't do that when you're constantly, in the wheel. So
right.
Having a do nothing day is part of my self-care. It still kind of feels weird, like I see that basket of clothes. I'm like, you need to be folded, and it doesn't fold itself.
It doesn't. I agree with you. That's kind of what I've been doing too, as saying no a little bit more, and being more patient with myself. Just emotionally being a little more sensitive to myself and my needs. So, okay, so we are almost at time. We've gone a little bit over. So those of you that are attending, thank you so much for being a part of our event tonight. Don't forget, you will receive a link with an evaluation at the end when we close out the Zoom. And please take some time and fill it out so that we can come up with amazing programming for future events. So we thank you very much for spending an hour with us tonight. We hope we gave you some motivation and some good ideas to stay heart healthy and emotionally healthy through this time and well into the future. All of us are available for questions. Eleni can help to get you in touch with us if you need to. And thank you to the Suburban staff who put this together. And that's it. Thanks so much, you guys. It's a wrap. Take good care. Thanks so much. Good night.